Next, from Chicago, Governor Pat Quinn is joined by the U.S. Secretary of Health and Human Services, Kathleen Sebelius, as they announce the beginning of health insurance marketplaces. This is one part of the implementation of the President's healthcare law, often referred to as Obamacare. This runs about 10 minutes.
Their health insurance market is that the patients who had accessed health centers in Massachusetts prior to having insurance, there was some expectation that some of that patient load would diminish and that people would choose other health homes. Just the opposite happened. They kept all their patients and they had more coming their way. The good news is they also had more revenue coming their way. So if you think that your patient load is going to go down, I would think again, because I think folks here have found a wonderful health home. I'm pleased also to be here with Governor Quinn, who has been an incredible leader during his term in office for health care, health reform, health initiatives for the people of Illinois that he serves. And I'm pleased also to visit a bit with Celeste, the board member patient who you'll hear from in a few minutes. But I think that is what healthcare is all about. It's all personal. It's about us and our families, and you'll hear that directly from one of the patients here. Today, I'm pleased to announce that our department is conditionally approving the blueprint that's been submitted by the state of Illinois for a state partnership marketplace. And that means, thanks to Governor Quinn's leadership, Illinois will be able to tailor the new marketplace that is available for open enrollment starting October 1st to the needs that are particular to the Illinois citizens. Today's announcement is great news for the state, particularly for the hundreds of thousands of people in Illinois who currently are without health insurance. So beginning in October, many of those folks will finally be able to sign up for coverage they need and deserve, thanks to this new marketplace strategy. The market will make finding the right health insurance plan less complicated and more affordable than ever before. Comparing and understanding plans will be easy and straightforward. People with pre-existing health conditions, and a lot of our citizens have pre-existing health conditions, won't be turned away or locked out or shut out of the new market. And tax credits will be available to help people who need the financial assistance. And what that means for thousands of citizens in Illinois and across this country is that the security of affordable health coverage will finally be within reach of many of our citizens. The marketplaces will also provide relief for Illinois small business owners. Now, what I know is that for years, small business owners are at the wrong end of the insurance market. Their premiums skyrocket much faster than wages and revenues, making it hard for employers to afford coverage that meets the needs of their employees. And what I hear over and over again from small business owners is often they lose their employees to larger competitors because of health benefits, because their best workers feel they have to go down the street or around the corner or across town to work for someone else to provide that health stability. Those days are coming to an end. In October, those small businesses will finally have a reliable way to buy affordable coverage for their workers, and they'll have the buying power finally that their large competitors have in the market. Insurers in the marketplace will have to compete for customers, which will also help to keep costs down. So ultimately, today's announcement is good news for all the people of Illinois. When our family members, friends, and neighbors have health insurance, we all benefit. We benefit from a healthier, more productive workforce. We benefit when kids can be in school learning instead of at home with a preventable illness. We all benefit when our premiums aren't inflated to cover the costs for those who have no insurance. And we all benefit when changing jobs or retiring early or going into business for yourself doesn't mean losing access to affordable health care. Much more work remains to be done in the coming months, but today's announcement is an important step forward. And I'm here to say I look forward to working with Governor Quinn and his team to make affordable health coverage a reality for all the people of Illinois. Thank you for inviting me here today, and it's my pleasure to introduce a great governor and a great leader on health care, Governor Pat Quinn.
Thank you, Kathleen. Thank you. Well, thank you, Secretary Kathleen Sebelius. I really want to thank the the Secretary and our President, President Barack Obama, who gave such a wonderful speech last night about the importance of decent health care for everybody. And that's really what the Affordable Care Act is all about. I was watching the speech. I saw you right there in the House of Representatives, Kathleen, as a member of the Cabinet. And we are very grateful for this approval here today. Our Secretary of our Health Care and Family Services is actually in Springfield right now, testifying before the legislature to get our statute passed to expand our health coverage to people who don't have that. We also are going to be passing the legislation for the health insurance marketplace. Those are two things I talked about last week in our State of the State address, and it's very important that we, the people, band together for something really, really important. We can insure literally hundreds of thousands of people who today are working and are part of our society, but they don't have health coverage. And we've got to do something about that. And I do want to thank our Director of Public Health who's with us, Dr. Lamar Hasbrook. Thank you, Doctor, for your great service. We understand how important public health is to expanding life expectancy and to have a good life. It's important that we have that decent health care. And Michelle Sadler, our Director of Human Services, is with us as well. I want to acknowledge her good work. You can come on up here if you want, dear Michelle. Don't be shy. And I also want to acknowledge a couple of our leading elected officials. One of them has retired. He's now the Director of our dental services in the Department of Public Health. You can get over here, Dave. David Miller helped pass the statute along with Representative Will Davis, another shy fellow. Well, you know, you can come over here if you want, Will. But Representative Davis, who's the head of our Black Caucus in Illinois, a strong voice for decent health care. And that's everything, as Kathleen just said. It's not only physical health care, it's mental health care, and it's dental health care. And that's why Erie Health Center is so important. We have excellent health centers, community health centers, all over our state. And we, thanks to these representatives, we were able to get funding to help those health centers either build something new or expand something they already had. And this used to be, right here, a Walgreens, right? Isn't that right, Lee? Dr. Lee? And it was readapted, this building, into a community health center on North Avenue. And I live west of here. I live on the west side of Chicago. Some people might even call that the best side of Chicago. But I'm not going to get in trouble with the south side or any other side of Illinois. But the bottom line is every side of our state needs to have access to decent health care. And we're going to hear in a moment from a person who lives very close to me, where I live, who will talk to, and testify to how important this mission is. We in Illinois, the home of our president, are going to work in the next 8 months to enroll as many people as possible. The official start date to enroll is October 1st. But we've got to get the word out about the opportunity to get health care coverage. But folks who are working hard and never had it before, we got to make sure we reach out to them. And I can remember back in 2001, I walked across our state of Illinois from the Centennial Bridge in Rock Island above the Mississippi River all the way to Lake Michigan. And I was with my doctor, Dr. Quentin Young, who was the doctor, the physician for Dr. Martin Luther King Jr. when he lived in Chicago in 1966. And Dr. King, along with Dr. Quentin Young, were together, and they said back then that the worst form of injustice is not having access to decent health care. It's a fundamental right. It's not a privilege, it's a right. We're folks who believe in taking care of our neighbor, as our president laid it out last night. We're in this together. We're a community. Everybody in. Nobody left out. So I really look forward to working with everybody here in this few months ahead to get everybody alerted to the importance of opportunity, joining up with the health insurance marketplace of the state of Illinois. Together we'll make the will of people the law of the land. There you go.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.